This talk is about hormones and body weight. And the first thing we're going to talk about is why gaining fat, and again, not weight, but body fat, changes your hormone balance. In your fat cells, there's an enzyme called aromatase. And this enzyme in both men and women converts testosterone and other androgens to estradiol. Estradiol, in turn, promotes body fat storage. And it does this by slowing thyroid function. In fact, it increases the amount of something called thyroid binding globulin in the blood, and that has the net effect of lowering one's thyroid level. So, if you gain body fat, you gain estrogen, your metabolism slows, and then you gain more weight. And so I kind of flippantly call this section, the fatter you get, the fatter you get. But I also mentioned that most people notice the first 5 pounds is bad enough, but the second 5 seems to come on twice as fast and so on. And it's a very real phenomenon. Other effects of excess estrogen, in women I should say, PMS, mood swings, water retention, bloating, heavier menses, excessive bleeding, irregular periods, cramping, and of course the big one, weight gain. Okay, now we're going to shift gears a little bit and talk about why starving doesn't work. And every time I do this section, I like to talk about 2 magic numbers. The first one is 800, and that's the number of calories you must consume to avoid starvation mode. If you consume less than 800 calories, your body starts to change its metabolism. It starts preserving its fat stores because that's its insurance policy, its protection against for the vital organs. And if you eat less than 800 calories, your body changes its thyroid metabolism and slows down what's called T4 to T3 conversion. That's inactive thyroid to active thyroid. The other magic number is 200 calories from carbohydrates. You have to have 200 calories from carbohydrates because that deiodinase enzyme that converts T4 to T3 is dependent on carbohydrates. If you don't consume those, you don't convert it. So some people may have noticed that when they do the Atkins diet, they're very successful for maybe 2 weeks and then it seems like they hit a wall. Well, again, that's a very real phenomenon that happens, and it's because of this adaptation that your body has. Quick note, if you partake in the HCG diet, you don't have to worry about these limitations on calories or carbohydrates because that has a way of overriding the system. Okay, now we're going to talk about lab work. And my doctor said my thyroid is normal. Well, your doctor tells everyone their thyroid is normal because they only run one test, and that's a TSH. It's not actually even a thyroid hormone. It's thyroid stimulating hormone produced by the pituitary. The problem is you can have tons of people with a normal TSH and a very low or low normal T3. Again, this goes into a lot of different situations why this can happen. One is the enzyme and the conversion situation. Another one is Hashimoto's disease, where your body makes antibodies to its own thyroid. So there's a couple situations there. There's also one called reverse T3, and that can happen in the absence of selenium. Your body needs selenium to make T3 as well. It can also happen after a trauma or childbirth or some kind of significant stressful event. So, signs of a low or lagging thyroid. Body temperature below 98 degrees on a continual basis. A lot of women will notice this. They'll say my body temperature is normally 97.6. That's what the doctor told me. Well, I got news for you. Nobody's normal body temperature is 97.6. There's probably something going on with the thyroid. Some other significant symptoms are cold hands and cold feet, depression, constipation, thinning hair, brittle nails. And the constipation, I should note that that's kind of a chronic constipation. The hair loss, generalized thinning, not a male pattern type situation, but a thinning throughout the hair or even a change in the texture. It becomes more brittle, dry, breaks easier. Same thing with the nails, and eyebrow hair is a big one. So, tests that should be run on a typical thyroid panel should be TSH, free T3, free T4, reverse T3, and thyroid antibodies. Okay, we touched on this just a second ago. Selenium is a trace mineral. It's essential for converting T4 to T3, like we talked about. It just so happens that in the panhandle of Florida, and in Florida in general, there is a void of selenium in our soil. And the research I've done so far shows that even if you have selenium in your diet, if you're devoid of selenium in the soil, people tend to have a deficiency, which is rare with selenium, or it's stated to be rare, but it seems to me more than a coincidence that this situation occurs. And I say here, I've seen more thyroid issues, including the reverse T3, here in Florida than I have in any other part of the country, and I've been around. Reverse T3 elevations usually happen maybe 1 in 100, and here in Florida, we see about 1 in 10. Okay, another thing about testing we all need to know. Levels are age adjusted. So a 50-year-old, the scale is different than it is for a 20-year-old. The problem with that is we don't want to feel good for 50, we want to feel good for a younger age, like we want to feel when we did when we were younger. And so the levels need to be optimized for a younger age. But when you do this, sometimes it'll show that your levels are out of the range, high. Well, in fact, they're not. They're just normal for a younger physiology. So again, target levels, this is kind of arbitrary, but 25 to 35-year-old is kind of what we shoot for. Lastly, if you've had saliva tests in the past, you wasted $400 and throw them in the trash. They do not correlate to symptoms. They are inaccurate, and by no means, well, you wasted your money. Okay, early signs of menopause or perimenopause. These are big ones for women. The insomnia is a big one, mood swings, and weight gain. The thing I usually hear is, I can't sleep, I'm moody, and I've gained 10 pounds and I don't know why. Well, this is because of a hormone imbalance. Actually, it's due to progesterone deficiency, which is the first hormone to disappear in menopause. Other symptoms not related to progesterone are hot flashes, night sweats, low libido, and the weight gain at the bottom, as we talked about, is a multifaceted thing. Okay, hormones and their benefits. Estradiol helps with hot flashes, night sweats, and bone density. Actually, it helps prevent bone loss. Progesterone helps with insomnia, mood swings, depression, and maintaining thyroid function. It also helps with fluid retention. It's probably the wonder hormone of the bunch for women, and it helps with insomnia because it elevates something called GABA. GABA is an inhibitory neurotransmitter that actually provides a calmness or almost like a Valium-like effect. So you can see where you're deficient in progesterone, where the opposite would be the case. You'd have more nervousness, more insomnia, more moodiness. Secondly, it acts as a natural antidepressant because it elevates serotonin levels. And everybody knows about Prozac and SSRIs. Well, progesterone is kind of your secondary natural SSRI because progesterone elevates serotonin. The other great thing about progesterone is that it helps to maintain thyroid function that is lost when there is an estrogen dominant situation or if estrogen monotherapy is used. And lastly, but not least, it actually will help to rebuild bone. And it does this by promoting what's called osteoblast formation, which is the little bone producing centers in the bone marrow. And progesterone can rebuild bone. Estrogen cannot. It can only blunt bone loss. So it's very important to have progesterone, even if you've had a hysterectomy. We tout this all the time. People have been told they don't need it since they've had a hysterectomy. They don't need to prime the uterus and so forth. But we include it because of all the many, many benefits that are inherent to progesterone. Testosterone in men and women both helps with libido, muscle tone, lowers blood viscosity, meaning it's a blood thinner, and so people are less likely to have cardiovascular events with good thin blood. Also, it helps to optimize thyroid, and it does this by facilitating that T4, T3 conversion we talked about. Adrenal hormones, DHE and pregnenolone, help with energy, tremendously with mood, cognitive function, aches and pains. Pregnenolone is a natural anti-inflammatory of sorts. And believe it or not, that combination has been used in studies to lower cholesterol. And there's been significant drops in LDL cholesterols. And Dr. Caputo will tell you about that. We've had significant drops in LDL and cholesterol overall when women and men go on hormone therapy. Okay, a quick overview of men. Fat gain increases estrogen production. In fact, it increases the percent of testosterone that's converted to estrogen. And what's really bad about this is that estradiol is actually the signal used by the brain to judge how much testosterone has in the blood, not testosterone itself. So you can see where if you convert a large proportion of your testosterone to estrogen, the signal sent is that you've got tons of testosterone and you don't need any more. And when this happens, the body's own production of testosterone shuts down. This is very bad for men, a very bad situation, because high estrogen leads to centralized obesity, fat gain in the lower abdomen and lower back, and even more importantly, more viscous blood, thicker blood. So men are more prone to cardiovascular events. Also, estrogen has been, just now they're discovering that estrogen can be a mutagen on the prostate, meaning you can have prostate cancers and other issues are likely to be caused by prolonged elevations and perhaps bad metabolism of estrogen. The other one is DHT, another conversion product from testosterone. The prostate and in the dermis, there is an enzyme called 5-alpha reductase. You don't need to remember any of that, but that's the enzyme that converts testosterone to the DHT, which you've heard a million times now on the TV and the radio about hair loss. That's the hair loss hormone. Recently, there's a study on finasteride, which is one of the blocking agents we use for men, showing that it reduces prostate cancers by 30%. And this is very significant because it fell out of favor years ago. They thought that it did not help at all. Now they know that it does. So in men, it's important to note that it is just important to elevate testosterone, but it's also just as important to block the bad things that testosterone can convert to. Okay, we talked about these. Increase your heart attack stroke risk, increase moodiness and mood swings, centralized obesity, and your testosterone production gets shut down. The other bad guy, we just spoke about this as well, DHT, the hair loss hormone. It's a negative byproduct of testosterone and one of the two pathways that we try to block during testosterone therapy. And what's funny about this, men, is that you will see no doctor out there will even mention estradiol for you. And actually, if I had to test one hormone in men, estradiol would be the one that I would test because it shows so many issues. And estradiol is the one that we have to keep low. It causes all the problems. And when we do that, when we block the conversion, good things happen. For instance, we can give you testosterone, prevent it going to estrogen, but in so doing, the body also keeps its own production up because it doesn't see an elevation in its estradiol. So it knows to keep kicking out more and more testosterone. Okay, final word. We'll sum it up for men. It's not just about testosterone. Remember, it's keeping that high and others low. And it's not about keeping things normal for your age. We want to be optimal for any age. And that just about sums it up. But just to reiterate, we want to block DHT and estradiol in men.